Okay, so we have here the stage 1, the clinical features characterized here by painless chancre at the site of the bite. So the chancre here would be characterized by painless, non-durated, rubberized lesion found on the skin bite, at the bite of the site, at the site of the bite. The patient would also have intermittent fever, which is refractory to antimalarial drugs. The patient will not be responding here if you give antimalarial drugs. The patient will have here generalized lymphadenopathy. For the late stage with a CNS involvement, so the patient with a persistent headache, which is also not responsive to your analgesics. The patient would have daytime somnolence, followed here by the nighttime insomnia. So, during the daytime, inantok ang patient, but during the nighttime, hindi siya makatulog. The patient would have also here behavioral changes, mood swings, and would have here some depression. Okay, and the patient would have loss of the appetite, wasted syndrome, and weight loss. So, wasted body. Ganun. And some patient would have here seizures. For the physical features, ay kanina pala, that's your clinical features. For the physical features, again, the patient would have here the early stage, characterized here by chancre at the bite site. Then trypanosomes will be present for the light skin patients. The lymphadenopathy, inflammation of the lymph nodes. So it depends on that. If we're talking about rhodesiense, the lymph nodes enlargement will be on the axillary and the inguinal area. But in the case of your in the case of your Gambians, the cervical lymph nodes. So that's your winter bottom sign. The winter bottom sign here characterized by the lymph node swelling here at the back of the neck. And that occurs only in your West African sleeping sickness. Again, sa ating rhodesiense, ang kanyang lymph node enlargement is found on the inguinal or axillary but not on this. Another one, the patients would have here, okay, the fever, tachycardia, irregular rash, edema, and weight loss. For the stage 2, the patient would have a classic glandular involvements. So pag we're talking about the Gambians, again, try to lesser for more than 1 year, so medyo mabagal ang manifestation and signs symptoms. But in the case of your rhodesiense, would have an abrupt manifestation of signs symptoms because it only lasts for 1 year. Then the patient would have here the Kerandel sign, which is the delayed sensation to the pain. The patient would have also have here the moon-shaped face. So characterized here by the puffy eyelid with a wasted body. So manas na manas sa mukha ang katawan ay laspag na laspag. Wasted body. And then finally the patient would have behavioral changes with a mania, psychosis, speech disorders, seizures, supporting coma. So that would be manifestly classic na sleeping sickness. Okay, for the laboratory diagnosis, we have here the blood smear, blood collection. So you could have here your wet mount preparation, and we could also the dry smear. For the wet mount, the best time to collect the sample would be on the same as your malarial infection. You collect it on the time na the patient is on the fever or towards the end of the fever. Okay, then you could have here your wet mount preparation. So you try to identify. So you collect the blood and then you add NSS and then try to observe for the presence of your trypanosoma. Trypanosoma makikita natin sa bloodstream. We try to be pushing here within the red blood cells. Having a snake-like movement if you happen to see na may gumagalaw, so that's your trypanosoma. We could also have here the dry smear, so just need to have the blood and then prepare a dry smear and then stain with your right or GEMSA stain and observe for the trypanosomes. And we have also the concentration technique with your 5 to 10 ml of the blood and you add anticoagulant, centrifuge, and try to take the plasma, collect the buffy coat, and then use the buffy coat and when you are making your smear to identify your parasite. Okay, then we have here the CSF lumbar puncture. So especially in the late stage, because again, meron siyang CNS involvement. So anything that could have your collect your CSF to identify the presence of the parasite So what we are identifying the CSF would be the presence of your mononuclear cells like your lymphocytes, monocytes. Also try to perform the total protein determination. If the total protein level is increased, it would indirectly determine or signifies that there is something wrong with your CNS, and it might be indirectly suggest that you have a parasite in your CNS. And again, let's speak about the late stage already. Okay, for the culture. Okay, for the culture method here, so you could have your NNN, your Tobis biphasic medium, and could also have your Riemann, specific only for the Gambiense but not for the Rhodesiense. Okay, now we go to your Trypanosoma Cruzi. Okay, the Trypanosoma Cruzi is the causative agent of your American trypanosomiasis, also called here the Chagas disease. Okay, so this is transmitted here by the bite of your Tryatoma bug or your Ridovit bug belonging to the following species. We have your Panstrongylus megestrus, Rhodius prolexus, and we have your Tryatoma infestans. Okay, for the life cycle, again, the life cycle of Trypanosoma cruzi involve all the stages of your hemoflagellates. Okay, so you get infected by the bite of your Ridovit bug. The Ridovit bug try to bite you and then try to defecate. Again, in the stool sample of your Ridovit bug will be the parasite is present. And what is present in the stool sample of that would be your metacyclic trypomacycot. So, ang nangyari dito, the Ridovit bug here try to bite you, and during the night time, as try to bite you, try to scratch the bite site. So, pag yung scratch mo siya, ang stool niya, pinapasok mo sa bite, kung saan siya nag-bite. So, and eventually, that will allow sa parasite to go inside your body. Then, metacyclic trypomacycot, this is the infective stage, the human. You go to your bloodstream, transform to a macygot pro-epi, we have here the bloodstream trypomacycot. And then here comes again here the next na Ridovit bug, try to take the blood meal, and try to ingest the blood coming from the infected patient. And what it ingests would be your bloodstream trypomacycot. This bloodstream trypomacycot will go to the midgut of the Ridovit bug, transform to become epimacycot, go to the hindgut, kasi doon sa behind hindgut, and eventually your epimacycot transform to become metacyclic trypomacycot. And then, again, the cycle goes on here once that newly infected na vector try to bite another patient and try to bite and defecate and eventually try to transmit the parasite. We have here the disease pathology first. We have here the Shagoma. So, Shagoma is the lesion primarily on the bite site. So, characterized here by the lesion. So, Shagoma is a lesion found on the bite side, most likely found in the lips and in your nose area. So, this is equivalent of the chancre found in your gambia, your brucei, Trypanosoma brucei. Sa kanya, you call this one Shagoma. Then the patient will also have here the Romagna sign. Romagna sign is the orbital edema here. Lumalaki na mamanas. That's your Shagoma. And lastly, we have here the patients would also have the Megas disease. Mega disease is the mega, means say this is the enlargement of the internal organs, specifically the uterus, esophagus, heart, ovary. So because of the loss of the destruction of the effector cells of your parasympathetic nervous system. So nag-enlarge lahat ng katawan ng vital organs sa patients with mega disease that's associated with your Trypanosoma cruzi infection. Okay, for laboratory diagnosis, so we have here the blood smear taken also here during the febrile stage or towards the end of the fever of the patient. So you could have your paropaden, you could have your wet mouth preparation, you could also have the dried smear. Serological testing, you could have your complement fixation. Complement fixation is your Machado Guerrero reaction, which uses the Kelser's antigen. So what you're detecting for this Machado Guerrero reaction will be the antibody once you get infected by Trypanosoma cruzi. And since you're using the Kelser's antigen, the problem with the Kelser's antigen, it could react with your syphilis infection. So, it might also here to your false positive reaction. So, pag nag-positive ka dito sa Machado Guerra reaction, you need to specifically determine if what the infection is syphilis or your Trypanosoma Cruzi because, again, your agents is capable of cross-reacting with your syphilis infection. Okay, and lastly, we have here your ciliates. Okay, so your subphylum Ciliophora includes the lone species here of the parasite which try to infect the human, the Balantidium coli. And the Balantidium coli considered to be the largest intestinal protozoans. But your Balantidium coli is actually is a disease of or the infection of the pigs, but not human. And human gets an accidental infection once you are contaminated with the stool sample coming from the infected na pig.